So the Eastern Cape is among the provinces with the highest numbers of infection as far as COVID-19 is concerned. It's confirmed over 500 infections. Frontline workers are at high risk, especially with those reports of a shortage or disproportionate distribution of personal protective gear. Let's get more on this now from Nursing Union Denosa. I'm joined by the Eastern Cape Secretary Khaya Sodidi. Khaya, very good evening to you. Thank you for being on ENCA. So the Health Minister today in that briefing with the Health Portfolio Committee making several commitments as far as the Eastern Cape is concerned. More help is on the way. He says PPE is there. It's just unevenly distributed. The Cubans will also be roped in to help the situation in your province. Does that soothe your worries anyway?
Yes, Temegile, thanks for having us as Denosa in the Eastern Cape. Yes, we can say in a way that is helping us because that help will come handy in the province because we've been having concerns about the capacity of the province. So what has been now provided by the minister in terms of reinforcement to the province, we think it's going to go the long way. But of course, still early to say it's going to help totally, but I think we are moving to the right direction.
Let me ask you about the health MEC then, Khaya Sodidi. She's come under a fair deal of criticism, or a lot of criticism, I should say, especially in the last week or so. People saying that part of the reason why we're seeing this escalation in the health problem as far as COVID-19 in the Eastern Cape is concerned is linked to her specifically. I know some sections of the ANC Youth League in the Eastern Cape are saying she should either resign or be fired. Do you blame her for any of the problems?
We're the first ones as Denosa in the province to call for the MEC to step down because of what we have observed in terms of the management of the COVID-19 in the province. We have even raised that directly with her office and with the office of the Premier. But yesterday we had a meeting with the Premier and the Department of Health, and they have taken us into confidence. And the Premier also apologized for the mishaps which has happened, and the plea was that the MEC should be given a chance so that it can take us through these turbulent times. So yes, we were the first ones to call for her to resign, but after yesterday's meeting, we are going to go back to our structures as Denosa and then give the report that this is an appeal made by the Premier and also by the MEC. Because MEC, she did explain herself of what happened when we are calling for her to resign, given the circumstances she found herself in.
So do you now believe she should stay?
That's why I was saying that we're leaving power structure. The one was saying she must leave was the member reporting to a higher structure in the province, which is called the PEC, Provincial Executive Committee. So we need to, the meeting was yesterday with the...
Okay, Khaya Sodidi is the Eastern Cape Secretary. I think we can hear him. Can we try to go back? Khaya, I want you to pick up, if you can hear me now, just on the point that you were making about the upcoming meeting with your higher structure to discuss the issue, including that of the MEC. Can you hear me?
Yes, I hear you, Temegile.
Yes, let's pick up on that point then about the MEC and whether you want her to stay or go now that you've had representations or presentation from the Premier especially.
That's why I was saying, Temegile, we're going to take that. The decision was made by that higher structure of Denosa in the province. So tomorrow, I think back to that structure, that structure is going to say they accept the explanation by the MEC and the Premier. So until then, tomorrow, they will pronounce our position. Otherwise, our position last week was to say the MEC must vacate a position because of what we have observed in what's happening in the province.
I want to go back to the issue of the personal protective equipment, the PPE that the minister has now conceded is available but unevenly distributed among provinces. How is it showing in the Eastern Cape? What is the situation?
Currently, the situation is that the PPE is not available in the manner we wish it could be. But like I'm saying that yesterday there was a meeting with the Premier where we are assured that they have already received some batch of PPEs, which they say they're going to start distributing tomorrow. Otherwise, as the current situation, we don't have enough PPEs, and that was our concern and outcry for the past 2 weeks, that we don't have enough PPEs. Until tomorrow or until beginning of this week, then we can see if the Premier and the ME and the Department of Health can live up with that promise of PPE being available to our institutions.
And just in terms of your monitoring, are you seeing a vast difference in terms of the protection of health workers between private and public health facilities, or are they all in the same struggle at this point?
They are all the same struggle, Temegile, because we've been receiving calls from the private sector institutions, from our members who are working in those institutions, complaining about the same unavailability of PPEs, which is the same as in the public sector. So the outcry is the same. However, we have been promising in the private sector that they are starting receiving now the PPE we are looking for.
And do you share the view of some, Khaya, who are criticizing the arrival of the more than 200 Cuban health professionals who are in the country, people who are saying that, in fact, what government should have been doing is giving more work to South African healthcare workers who are sitting without employment instead of accepting this offer, which comes at a price? Do you agree? Yes, we support that view as Denosa, that maybe a consultation should have been done first with the people who are employed, because we do have a number of unemployed nurses. We're not sure about the doctors, but we think that the nurses who are unemployed could be of great assistance even before we can consider outside help. So yes, we think that it was a premature of the department or of government to bring in Cubians before maybe we can sit down and look where are the gaps. So we don't know where the gaps now. As far as you know, there are lots of unemployed nurses in particular who can offer great help. Because remember, our nurses have been highly trained for infection control. The only thing now we need is for them to be trained in this current new virus, which is coronavirus. Khaya Sodidi, Denosa, Eastern Cape Secretary, thank you so much for being on ENCA tonight, sir.